So of course my voice decided to start going right before this, so I have a couple cough drops, so hopefully I'll make it through. But I wanted to just thank Matthew and his crew for inviting me to this. I cannot tell you how excited I am to see this program and to hopefully help it in the future, because I think for me, youth sports is just so essential to everything that we do. So I want to give a thanks, and thanks for including me. So we're going to talk about injury prevention, and this is our roadmap. Essentially, I want to just take you through quickly what are the risks of injury in sport. I mean, we all know that there is a risk. Understand the interventions that are available, and I think Jason brought up a good point. Injury prevention is kind of a misnomer. We really can't prevent. People are going to get injured, but it's that risk benefit, right? If we can mitigate the risk and just maximize the benefit of exercise, I think that's really what our goal is. And then also discuss not just the musculoskeletal components that put us at risk for injury, but also other things that can contribute. I know you're sitting in this room, so you're missing the nutrition and the sleep talk next door, which you can watch later, but we'll touch on that a little bit as well. So we know that injuries happen. There's risk when we play sports. And I like this sign here about that you're entering a high-risk area when you enter a sports center. I'll give you a little story. When I was the team doctor at Northwestern, we went to play a team in Texas. And as you're walking into the football stadium, the sign above the thing for the visitors coming through is, "Heat will kill you." And I was like, okay, they're playing mind games with us, but it's kind of true, right? So there's risk, right? When we look at the rates of injury, I gave a similar talk to this back in 2016, and so I had that talk, you know, and kind of we all do that when we've done this long enough, and we just kind of update it. So I went back to look at the data, and not a lot has changed, unfortunately. So in 2022, there are 3.6 million emergency room visits related to sport and exercise, and that's adults included, but we saw more males than females. The good news is that 91% of those people went home from the emergency room. They weren't admitted, they got their care, and they moved on. However, did they actually recover? Did they get a plan on how to get back from that injury? So I think this is also interesting to look at. So if you look at the data, when we're talking about our youth, we see this big dip, which I think we can all guess what happened here. This is 2020. So people weren't playing sports, right? We weren't being as active. Or I think in Utah, you guys were probably still being active, but I was still in Chicago. They closed our lakefront. Our lakefront is where the bike path and the running path is. Our mayor said we couldn't go outside and recreate. So it was very strange. So for a lot of us, we weren't able to do what we normally do. So you see that little dip. There were less organized sports, clearly, at that time. But generally speaking, these are the two big age categories that we're focusing in on in terms of injury. Importantly, I'll give you the next one. I want to bring to your attention that really bike accidents are the biggest thing that shows up in the ER, along with just exercise injuries in general. So, you know, football gets a really bad rap. But it wasn't the number1 thing. Basketball actually had more people showing up in the emergency room. So, and that's kind of true throughout many of the things that we look at. So just to keep that in mind, that it's not just always sports, but bikes and trampolines, very dangerous. What about concussion? So, right, that's another injury. When we think injury, concussion definitely comes to mind. I have many parents ask me, like, would you let your child play football, or would you let them do this or that, because concussion is such a risk. So this was a study that you guys did here in Utah for 8 years, and it was just the injury reporting through the schools. And so it was not just sport, but I pulled out the sport part. 75% of the concussions that happened at school were sport related. And you can see here again that basketball, they're just getting a bad rap, but they're kind of up there, right? And this is, again, because we're looking at K through 12, those younger kids probably weren't playing football at their kindergarten. At least not organized and reported to the school. And so that's, I think, why you see a little bit of a difference in the number. But importantly, I had a swim coach tell me once, I don't need concussion education, my swimmers don't get concussions. And then literally that afternoon, one of his swimmers slipped on the pool deck. So don't ever say those things. So it can happen in anything. And actually this cut off a little bit down below track and field, dance. Dance teams, they kick each other in the heads, they drop each other, palms and dance, high risk for concussion. So what about by age group? I really want us to be focusing in on those age groups that we talked about earlier, that, you know, this 10 to 14 and 14 to 18, you can see that these are just a representation. These clearly aren't all the sports, but you can see the biggest components of injury are in these ages. And the reason why, and we'll get to that in a little bit, is because kids are growing, right? And we'll talk about why that puts them at risk. What about by sex? Well, obviously, we don't have as many females playing football, so that's a little skewed in our data. But again, males are showing a little bit more injury than females generally. And then by body part, again, depending on the sport, so when you look at baseball and softball, you're seeing less lower extremity and obviously more kind of upper extremity, face and head, versus the other sports, which tend to have a more increased risk of lower extremity injury. So what are our risk factors for sport? When we talk about risk factors, we talk about what's intrinsic and what's extrinsic. So things that are intrinsic, some are not modifiable. There's genetics, your age, your gender. Those typically, really, that's not going to be changeable in terms of when we're talking about sports injury. There are things that you can modify intrinsically, so your strength, your flexibility, working with someone like Jason to do those things, to get you bigger, faster, stronger, to address your biomechanics. Also addressing internal stressors, right? We'll talk about mental health at the end of this, but how are you managing your stress and how does that impact your risk for sport injury? And then in extrinsic, all the things that we can control. We can control our training, we can control our nutrition, we can hopefully control our equipment, or hopefully our parents or our coaches can control that. And then the environment too. So, the heat in Texas, but also the outside stressors, the helicopter parent, the too aggressive coach, all those things. So those things are things that we, as people who are advocating for youth sports, need to be paying attention to those and making sure that our kids are only having positive influences and not negative. So I really like this study when I was updating this talk. It's not quite new, but it's not quite old, 2017, but it's a good friend of mine, Andrea Streccolini, who's at Harvard. She's a pediatrician, and this is another passion of hers. And so she and her colleagues put together a kind of just an overview. What is the current science? What do we know? And this hasn't really changed. And I think the most important thing from this slide is what I have highlighted down here, that if you have a prior injury, that is your single most important risk factor in terms of another injury. So we really, again, we can't prevent injury, but if we can minimize the risk, or once you have an injury, if we can recognize what caused your injury and if there's something extrinsic or intrinsic that we can change, that's going to really serve you the best in terms of preventing future injury. So the other things that can contribute, certainly growth, and we're talking about kids, and they just keep growing, so that's part of the risk. The biomechanics, and then overtraining or under-recovering. So those are some of the things we're going to focus on. So prior injury, I already told you, it's the biggest risk factor. So failure to recover from an injury exponentially increases your risk of another injury. And I always talk to my, we think about ankle sprains, right? A lot of people, I rolled my ankle like 5 times. Well, why did you roll your ankle 5 times? Did you ever go to rehab for that first one? No. And so that's a conversation that we have oftentimes in the office when an athlete is coming to see me and they have chronic ankle pain. And we dive into it and we're like, okay, yeah, you've never done actual rehab for this. You've never worked on your proprioception. What happens with an ankle sprain? The swelling goes down, our strength comes back, bam, we're back in the game. And we never do the balance or the kind of cross-training stuff that we need to kind of retrain our brain to tell our ligaments where they are in space. So I think if that's one thing you remember from this talk, is that you have to address the injury and you have to rehab it appropriately, and using our physical therapists, our athletic trainers, our strength and conditioning coaches to help. I'm just a doctor in an office. People don't come to see me. Athletes try to avoid me, but all those other people in the community, all of you sitting here, you're the ones that can actually make the difference, or at least get them to me so I can tell them that they need to listen to you. So we all need to be identifying that. We need to also identify that there is a loss of function or there is a weakness before we let that athlete go back into play. The temptation is, just go back. You look okay. They're saying they don't have pain, but is anyone actually looking at them functionally and seeing that that's actually true? And so where I can help is when kids come in for their sports physicals, we're looking at what injuries did you have last year? What things are still nagging you? And at least I am, we're trying to look at them functionally and see what is the weakness particular to their sport. Like if it's, an upper extremity athlete, do they have absolutely no range of motion in their shoulder? If it's a lower extremity type athlete, do they have horrible control? Are their knees just going in? And we'll talk about that as well. So then, I guess we'll just use this. Oops, sorry, guys. It was working. There we go. Okay, so the next thing is growth, right? So this is the other conversation I have with my athletes when they come in. You know, the parents are like, why is my child in here all the time? Well, your child's 15 and they just grew 8 inches in the last year. They are Gumby, right? They cannot control their bodies. And so we know that growing definitely places young athletes at risk. So every time you grow, you actually get weaker before you get stronger. And so you need to be addressing that. As coaches, as parents, we need to be paying attention to that. There's definite vulnerability in the youth athlete, both in their cartilage and in their soft tissue. So they can get defects in cartilage, which are called osteochondral defects. They can get stress fractures. They can pull their growth plates off their bone, and that is, you know, like you think of a sprinter when they kind of power off, you know, using kind of Jason's, you know, discussion about really pushing off the ground when you sprint. Well, if that growth plate is open in their hip and they push off and they just pop that little bone off and they come into me and they're like, I can't move and I can't lift my leg. So that is a common thing that we'll see in that kind of 10 to 16 age group, and depending on what sport they're doing, we need to be paying attention to that. Specifically in females, so prior to a young female athlete getting their period, when they have their peak growth, so they reach their peak growth and then they have their period, that is when they are most vulnerable. That is also when they're probably specializing in their sport or increasing their intensity of their sport, and that's why they're getting more injuries. So we need to be paying attention to that. We need to be training our female athletes different than we're training our male athletes for that reason. And we need to be modifying workouts, not just for them, but for just generally speaking when we're talking about athletes that are going through growth phases. And that includes reducing training, changing the load, allowing for more rest between training sessions, and that's going to really help. It's going to make my job easier. Okay, so then the next thing, neuromuscular control. So this is a whole conference, right? So the neuromuscular control training, and you guys will talk about it a little bit, but it's beyond the scope of like the 30 minutes they've given me. But suffice it to say, because our kids are training into a specific sport at a very young age, they're no longer on the playground just running and jumping and doing normal things and developing their foundational movement. So when you have the 5-year-old gymnast or the dancer or the figure skater, and I'm picking on girls, I'm sorry girls, but like those are the sports that really specialize early. They're missing out on like jumping off of monkey bars and things like that. So we're missing out on developing those fundamental movements, and that is setting us up for problems later on. So we need to take a step back, and we need to really learn about those foundational movements, and we need to be doing that as parents and coaches. We need to be encouraging our kids to play. And we made it sciencey, and they say, consider integrative neuromuscular training in PE. So don't just have the kids in PE play dodgeball, like actually spend 15 minutes in second grade and have them practice jumping and cutting and running and doing things for the first 15 minutes, and then let them go crazy and play dodgeball. But if you can take those first 15 minutes of a gym class and teach those fundamental movements to the primary grades, it's going to help them so much more when they get to middle school and beyond. So it really kind of takes a village to prevent injury is what I'm saying. We know that then once we hit puberty, there's a huge disparity. All the research shows girls get way more ACL tears. This is just, again, we're going to pick on girls, but they get way more injuries with regards to the ACL than boys. And why is that? Well, when we hit puberty, boys get testosterone and they get stronger as they get taller, and girls don't get the benefit of the testosterone surge like boys do. And so what they find is as the girls get taller, they lose core control, they lose strength in their hips. They can't recruit the muscles as well as their male counterparts. And we've tried to blame all kinds of different things, like is it that certain phase of a woman's period? We can't really prove that. It's very much multifactorial, but I think the biggest thing, and again, going back to core control and what we call the dynamic knee valgus, that has been the most identifiable thing that we can do in terms of predicting injury. So when I see any athlete in the office, we have mirrors in every exam room, and I have them stand. And I'm like, first I have them show me a squat, sometimes horrific, and then I hope mine was okay, Jason. Okay, and then we have this pressure. Like I've never had someone watching me, and then we have them do a single leg squat. And so don't judge me on this, but we have them do a single leg squat, and we try to tell them like I actually don't coach them. I'm like, just do a single leg squat, and they do this. And so if you see them do that, that is like red flag, like stop, cease and desist. And I have them look in the mirror so they can see it too. And I'm like, what do you see when you look in the mirror? And they'll Most of the time they get it. But I explained to them, if every step you take on the soccer field is a single leg squat, right? When you're running, if every step you're doing this, you're gonna come in and see me with some kind of pain from your hip down to your ankle. Something's going to happen. We don't want it to be an ACL, but we also don't want it to be patellofemoral syndrome, which is the anterior knee pain. We don't want it to be an ankle injury. So we know that if we can identify that, and it's not just the women, it's also men, that's going to help us to prevent injuries. So neuromuscular training programs, there's lots of them. We'll talk about the one that's probably the most common in a second. But basically, the components of the program need to include strengthening. When I show them that squat, and I'm like, okay, why is your knee doing this? Well, you have no core control. If you can engage your core, I'm like, tighten your abs, squeeze your butt, and then move, it's much better. But you can't think like that when you're running on a field, right? So you need to train it. So strengthening exercises to train that. You can see the difference between the two athletes. Plyometrics, or repetitive jumping exercises. But it's not just, hey, go jump off a box. Like, you need to have a coach or someone watching them. And again, we want to be doing this before high school. Grade schools don't have athletic trainers in their midst to help with this. So again, it's going to be like train the trainer. We have to teach coaches and parents to be watching for this. And this really does work if we do it. It can decrease rates of both ACL injuries, anterior knee pain, ankle sprain, so on and so forth. This is just saying what I just said. The research helps. The research supports what we just said. We can see reductions in risk of injuries in adolescents and young adult athletes in the range of, it's usually we say like 35%. It can reduce the risk of acute injuries, but also overuse injuries. And it's not just for soccer. We see it in basketball, we see it in baseball, we see it in all kinds of different sports. So there's been lots of research in this realm. And probably the biggest one is in soccer. So FIFA 11 Plus is an injury prevention program that's been around for 20 plus years. And I was just at my sports conference about a month ago, and we had some of the people who designed this program speak. And so they kind of gave us the latest and the greatest. And basically, yes, if we do this, it can decrease the risk of ACL injury, not prevent, but decrease the risk. It says prevents up there, so I apologize. But it can reduce your risk, but if you do it over seasons, it can continue to provide that benefit. However, there's difficulties with this, right? So we train a team to do it. Usually the impetus for doing one of these programs is there's been an increase of ACL injuries on my soccer team. I'm really nervous. Can you do something to help us? So then they come up, they look up a program, whether it's FIFA or one of the other training programs. You have coach buy-in right then because they know they need their players on the field, so we need to figure out a way to make them better and not have this happen again. So you have to get the coach buy-in. You also have to get the athlete buy-in. If all their teammates have just torn their ACL, the athletes are much more apt to want to do the program versus if everyone's healthy, they're like, why are we doing this? The problem is, this is a study that looked at the Norwegian program. This is, again, an older study, but basically they had a whole bunch of injuries, the first green dot. They did the program, they decreased. They stopped doing the program, it went up. Then they took a couple years off, and then went up even further, so like, oh gosh, we better do this again. And then they started doing it and continued to do it, and their rates kind of stayed down. However, you've got to do a lot of treatments, or we call it number needed to treat. So you have to train 120 athletes, give or take, to prevent one ACL injury. So that's a lot of manpower, a lot of time. So is it worth it? How many people in here have been involved or done some sort of neuromuscular training program or injury prevention program? So do you guys think it was worth it? Do you think it's worth it? Yeah, science is science, right? The numbers, whatever, but if you're the kid who doesn't get the ACL injury, of course it's great, right? So I think it's not necessarily preventing that one injury, but I think what we need to think about is those kids who've already had the injury, they're the ones who really do the best with these programs. So if we have 100 healthy kids who have a perfect single leg squat, yes, they're still at risk because bad things happen on fields and unexpected movements can happen. But those really high-risk kids, the kids who've already had injuries, those are the ones that we really need to be paying attention to. And so that's more like secondary prevention, we call it. We also need our coaches to understand why it's important. So not just because they're panicking because their team is having a whole bunch of injuries, but they need to believe that it's important. They need to understand what programs are available, but then they also need the support. Like anything, time and resources are the biggest stumbling blocks to implementing any kind of program. So if they have a perceived lack of time or lack of support, it's going to be less likely that they're going to do it. So we really need to be helping our coaches. The FIFA people are saying they're really trying to even have a lot of online, everything is social media, so having QR codes and being able to do that. But at the end of the day, there still needs to be someone watching the people doing the program to make sure it's being done correctly. So then moving on to the next risk factor, overtraining and under-recovering. Again, a whole talk in and of itself. We know, and it's been said throughout the conference already, that early sport specialization is rampant. Kids are specializing in their sport way too early, and that is leading to problems with overtraining, just increased volume of an activity, right? If you hammer a nail 6,000 times, your rotator cuff is eventually going to wear out. We used to say that in my fellowship back in the dark ages. You won't get a rotator cuff until you're 40 because there's no way you can wear it out. Well, that's not true anymore because we have kids throwing baseballs for like hundreds and hundreds of times. So that sport specialization is something that we're trying to address, and that kind of couples in with excessive training hours. But also inadequate fueling, inadequate hydration. We know that if you have a low energy balance or if you're dehydrated, you are way more at risk for injury. And then sleep. We're going to talk about all those in a couple slides down the road. But all of that can lead to both injury and illness, and that impacts our ability to keep kids on the field, keep them happy, and keep them healthy. We also know that, again, going back to the sport specialization, that multi-sport athletes actually do better. So they have better fundamental movement because you're using your muscles in different ways. So I take care of a lot of dancers, and so I tell dancers, I mean, they use their bodies in crazy ways, right? What can they do different? Like, should a dancer then go out and run? No, because they're jumping and using their legs all the time. A dancer should go swim, do something that offloads their joints and lets them move in a different way. And so similarly, we need to be thinking about when our athlete is doing a sport, what would complement it, not kind of create additional work of the same joints or the same movements. And then my most favorite thing, so this is the number 2 thing that you guys need to remember, is this right here. So how many people have heard about this, that the risk of injury, you have an increased risk when your number of hours of training is greater than your years old? How many people have heard of this? Only a few, like nobody. Oh my gosh. Okay, this is super important, and I tell every athlete that walks through my door this thing, and I basically tell their parents too. And then they get really panicked, and they're adding up the numbers in their head, and they're like, oh my gosh, I'm exercising, I'm 12, but I'm training 20 hours. Dr. Jaworski, please don't make me stop doing my sport. The point of it isn't to make you stop doing your sport. The point is to educate the parent and the child that you're just at increased risk, just by the sheer fact that you're doing that much volume. So we need to be aware of that, and we need to be watching for it. So I'm fine if that kid is like skipping down the street and super happy to go to practice, and they're healthy and they're not getting sick every other day, and they're not crying to their parents that they don't want to go to practice. By all means, do your sport. But if they're doing the opposite, if they're either always hurt or always sick, or they're not happy going and they're just going because you want them to go, we need to reevaluate. So this is an ongoing discussion that we have in the sports medicine world. It's a really good study, and again, I'm biased. It's 2 of my colleagues out of the Chicago area, Dr. Jayanthi and Dr. Labella, and they did a really long-term study, and they continue to do ongoing studies. And this holds true for up to 18. So really just, again, education, not taking kids out of sport, but just educating that we just need to acknowledge that if you're doing that type of training, you are just at increased risk. Questions on that?
Is that training plus practice? Like, if you're a dancer, you 4 hours of dance per week plus in addition to 2 hours of training per week?
It's of your primary sport or anything that's same movement patterns. Yeah, but I would argue every kid needs a day off. We all need a day of rest, right? We need a recovery day. But yeah, it's more related to your specific sport. But yeah, dancers try to get around it all the time though. So it's funny that you guys said. They dance all the time, yeah. So that's, those pre-professional programs for any sport, like the youth travel teams, it all adds up. So any other questions? No, okay. So that brings us to concussion injury prevention. Can we prevent concussions? Probably not. But I think what I want you to know in terms of concussion injury prevention, helmets don't prevent concussion. The reason we wear helmets is to prevent skull fractures and other things along the line. So they can slow down the impact, but they can't actually prevent. And also, how many people have seen Q collars or have heard about or read about? They also cannot prevent concussions. And there's new research that has just come out with regards, because I know that Q collars are super popular right now in lacrosse and soccer. And so there's very good research to kind of refute the claims. Does anyone know like kind of the theory behind the Q collar?
Basically, it's putting pressure on the W vein,
Yep.
decreasing the amount of venous return, so increasing cranial pressure. So then that way it's not the brain doesn't
Slosh around, right. So what he said is we're constricting our veins in our neck, so then you have more blood in your head, so theoretically your brain can't slosh around. I always explain concussion as your brain is like a bowl of Jell-O, and if anything makes the Jell-O wiggle in the bowl, that can cause a concussion. That's very, very simplified. And the theory of the Q collar came out of woodpeckers. They looked at woodpeckers and they're banging, into a tree or into wood repeatedly, and why does the woodpecker not get a concussion? Well, I don't know if we really can test a woodpecker for a concussion, honestly, but that thought was that what happens is they constrict their veins, and then that doesn't allow their brain to move around when they're hitting. Yes?
I'm big into birds, and another study that has been done.
Yeah.
I've seen a woodpecker's skull. I've gotten to go to the Cornell lab of one of them.
Cool.
See samples and stuff.
And their brain's like probably like this big, right?
Yeah, their brain's tiny. But what they do is woodpeckers have a tongue that wraps around the back side of their head.
And holds it in place?
And cushions the brain.
That's so cool.
So in addition
Yeah.
to the blood flow, it's cushioning that we can't replicate.
So I don't know if we could hear that in the back, but basically the woodpecker has a tongue that holds its brain in place. But we are not woodpeckers. And so save your money, don't buy the Q collar. I'm probably gonna get in trouble from the Q collar people because this is gonna be on social media, but nonetheless. Our best approach with concussion, like everything else we're talking about today, is to educate, right? So our athletes need to understand why we care. You only get one brain, we'd like you to keep it intact. We need our coaches, our other teammates, everyone to be aware of what are signs of concussion, when we should be concerned, and that we want to get kids in early because we're sports medicine. We would like them to play sport. If you don't tell us you have a concussion, we don't know, and then you take repeated blows, and now you have chronic headaches or something way worse, that is a miss on our part. So we need to be educating, identify the athlete early, and get their treatment started. And the good news is nowadays with concussion, we want you moving. We're not locking you in a dark closet. We're having you exercise and do things right away. So that is really the gist of what we're talking about with concussion. And so then kind of wrapping it up a little bit here, injury prevention opportunities. So we've talked a lot about like doing some prehabilitation, identifying things before the injury happens, and also rehabilitation. So when an injury happens, we need to be addressing that as well. An athletic trainer can be, how many athletic trainers in the room? I'm not getting paid by anyone to say this, but a couple, one, just one. Okay, well, I am a huge fan. Athletic trainers do an amazing service, and so the more that we can support them and have them at all sports levels, that would be terrific because they can be our eyes and ears, and they can do rehab programs, and they can keep kids healthy. Equipment, right? So AEDs got a lot of attention after the Damar Hamlin injury incident. Chest protectors, mouth wrist guards, all those things. I know I said helmets don't prevent concussions, but they prevent other injuries, so please wear helmets. And then changing rules and regulations to protect our athletes. Youth hockey is the biggest example, so they found that when they decreased body checking in the youth hockey programs, injuries went way down. Shocking. And then, why? Next level prevention. Aside from everything else we've already talked about, this is just like a little taste so that you go and watch the other talks that are happening subsequent tomorrow at the same time as mine. So all you need to know about menstrual irregularities is it is not normal to not have a period. Once you've started having your menstrual cycle, you should keep having your menstrual cycle. Now granted, when you first start, it might be a little bit irregular, but if you're missing a period, if you have not had a period by age 16 or you've missed more than 6 in a row, you need to see someone, and I would argue you need to see someone before 6 months. I would say if you've missed more than 2 or 3 in a row, that should be a conversation you're having with your doctor, because what we know is that that is a sign. Women have this amazing thing, this period, that will give them the information that they're overtraining. So if they stop having a period, that means their body's taking energy from somewhere else, and we want them to have a period because it protects their bones. No one really wants to have a period, I understand that, but if you don't want to have a stress fracture. So that's kind of how I talk to my athletes, because your risk of stress fracture goes up exponentially. So speaking of bones, we want you to get calcium in your diet. So you get those little milk containers when you're in grade school, and then they don't give them to you in junior high or high school. We need you to be getting calcium because you build your bone up until about age 30, and that's all you get for life. So you want healthy habits and build your bone, and you'll watch the other talks so you can learn more about that. As well as disordered eating happens in sport. We can't avoid it. We need to be educating. We need to be recognizing because, again, if we're not getting enough energy, then we're having problems with our bone, and that leads to injury. And that leads to relative energy deficiency in sport, which, again, not the purpose of this talk, but it does, if we don't have enough energy, what we used to call the female athlete triad, which is what I just told you about energy and menstrual cycle and bone health. We've learned it's way bigger, and we learned it also affects men. So it affects every single system in our body, including our mental health. So if we can prevent energy balance deficits, we can help a lot, okay? And I think the key take-home point from they just did an update from the relative energy deficiency folks. And what we learned is that low energy availability, we all been there, like, oh, I forgot to eat lunch and I'm supposed to go practice, shoot. You can get away with it sometimes, but if you keep doing it, it will cause problems. The other important part is even if you're not low energy availability, if you're low carb, which I know there may be people who don't believe in this, but it's been proven that if you don't have carbs, you are at increased risk for injury, and it affects your bone remodeling, so it puts you at increased risk for bone injury. And that also, this energy deficit that we're talking about absolutely overlaps with overtraining. So when you come in and you're like, I think I'm overtraining, like I'm getting injured all the time, the first thing I'm gonna look at is how much energy are you putting in your tank? So food is fuel, and that's what keeps you going. Mental health. Sports are great for keeping us healthy and keeping us mentally sound. It decreases the risk of depression, anxiety, whatnot, but it also can cause those things too. So we need to keep our head in the game. We need to address mental health issues before they become a problem, before they cause injury. Lastly, sleep. So we need to recover. We need to give our bodies time to heal. Not naps through the day or through class, but nice sleep at night where we can actually let our bodies recover. We know that if we don't get enough sleep, our hormone balance becomes out of whack, and we also have lack of muscle repair. So sleep, sleep, sleep. And for our young athletes, they need to be getting 8 to 10 hours per night, ideally. So that can definitely help in terms of prevention of injury. And this has been recognized at the Olympic level, at the NCAA level, but we need to recognize it at our younger athlete level as well so that we can prevent injury. And you can see all the different things that can impact your VO2, your lactate, your anaerobic and aerobic power, your strength, so on and so forth. And I'm often disturbed because I hear these programs and travel teams where they're like playing tournaments till like midnight. I'm like, there is no reason. I understand, like, what is it, ice time, court time, whatever. Like, no, like we as adults need to like stop that from happening. And I think Matt was saying at the beginning, like he wants dinner with his family. Like we all want dinner with our family. So like we as the people who kind of pay for all these things for our kids to do, we need to be putting our foots down and not letting that happen. So it's not all bad news. Like we started this whole conference, sport is good. Even if there's risk of injury, there are all these people in this audience who care about preventing or helping when someone gets injured to get them back into sport, because we know, generally speaking, the benefits 100% outweigh the risks of participating in sport. So our take-home points, you can see them here. I don't need to read them, but basically a summary of what I already said. We need to just move and have fun and play. We need to be educated, and we need to ask for help when we need it. And then I just gave you a few resources. These are just some of the places you can get additional information. The Stop Sports Injuries, Corey Stringer Institute, Heads Up is by the CDC, primarily for concussions. And then U.S. Soccer does have a wonderful Recognize to Recover program, which is for player health and safety. And it's applicable across other sports. It doesn't just completely relate to soccer. So that is it. I will entertain some questions if people have questions. And I'll try to remember to say the question first. Yes.
For concussion stuff, is there any studies that support upper body strength and helping to reduce concussions?
So,
it seems like, soccer
yeah,
specifically,
yeah.
it seems like our female athletes get more concussions when heading the ball than our male counterparts.
So
Does that have to do with muscular mass?
So the question is, does upper body strengthening, particularly in soccer, help to prevent concussion. And so I think the biggest stuff that they've been trying to look at is neck strength, right? So does neck strength or control help to prevent concussion? Maybe. So I think that the research that's out there, they want to show that there is a correlation if you have a weak neck musculature, that you're more at risk for concussion. But the problem is it's so multifactorial, and especially with heading in soccer, like it's where that ball hits your head, right? And so I think it's more about, again, foundational movement patterns and whatnot. Is there harm in strengthening your neck? Absolutely not. So should we do it as part of our training? I think there's no harm to doing it. Have we been able to scientifically say, absolutely, you have reduced risk? No, unfortunately.
So with concussions as well, I know before they were kind of saying, oh, okay, you kind of get 2 concussions, you're kind of done, and then the ones that have had concussions,
Right.
they say it's more about the proper recovery.
Okay, so the question,
If you
yeah.
properly recover,
Yeah.
you have had concussions, it'd be good.
So let me say the question and then I'll tell you my thoughts. So the question is there like a number of concussions that you can have, or is it more about how you recover? Is there a set number? So yes, that was all. In medicine, the number 3 just permeates everything. So 3 concussions and you're out. And I remember kids in high school like being excited when like the guy who's in their spot like gets a 3rd concussion. All right, he's out, now I can have the spot. Well, no, that's not how it works. So what we've learned is that it's not so much how many concussions you've had, it's how your body responds to the concussion. So how I explain it to parents and athletes is that you come in and you see me for a concussion. And if you recover on like the timeline that I expect you to recover, which for youth athletes can be anywhere from 2 to 4 weeks, if you follow the normal recovery, and when I see you the next time in the office, you're not like in the fetal position with the lights off and like dark glasses, you're probably gonna be okay. We know that most of the people who have trouble with concussions, there's probably a genetic predisposition. 99% of people are gonna do just fine, myself included. I had a concussion, I still got to go to medical school, and I think I'm doing okay. But the problem comes in really, and not that we want someone to have a second concussion, but I really can't tell you for sure until you have a second concussion, and we see how your body responds to that second one. Again, not the goal, but that first concussion, if you follow the pattern and you get better, I'm really not worried. You need to go through a proper like progression, and the high school association here has a great way to do that. All our athletic trainers know that very well, and I would encourage people, if you have a younger athlete who has a concussion, see someone who specializes or treats concussion, because the data and the literature changes like on the minute, and so you don't want to see someone who hasn't updated their knowledge on concussion, because then you won't be getting the most up-to-date care. But that second concussion, when you come in and you've had a second concussion and you're responding just as well or better than the first one, I'm really not worried about you. I'm more worried about the athlete who has 3 concussions in a season, right, versus 3 concussions over the span of 10 years. So again, it depends how you respond to the injury and the timeline of your injuries, and that's going to really help me make a decision. I had a soccer player who had 5 concussions in his career collegiately, and he's fine, and he's a productive member of society as an adult. I had a young girl who only had 2 concussions, and it's very rare that on a first visit with a patient that I'll say, you should not do this anymore. But hers was so severe, she was thrown from a horse, and that was the first concussion, and then second concussion was with soccer, but that first injury just set her up, or maybe she genetically was predisposed, but she said enough things to me that in that second concussion, I was like, we need to pick some different sports for you. So it kind of depends, but generally we're looking at those 2 things I said. Yeah.
I have a question about like the very beginning athlete injury. So I
Yeah.
volunteer coach for like middle school running, and you get kids who are like playing all the sports,
Yeah.
and then you get kids that parents are like, just go try this, running, it doesn't require
Yeah.
everything else. So, and they're getting a lot of the shin splints and the aching knees, but I want them to have a positive experience,
Right.
moving their bodies, and so how do I better support them, and like that, because they haven't done all the running and playing.
Right, right. So the question is, how do you support that like novice athlete? And I think your example is perfect, the running. So we see this all the time, the start of track season. Track is a no-cut sport. Anyone can go run, but should everyone run? But we want to encourage movement. We want to encourage people to be active. and it's really difficult because like 3/4 of the team in that first month have shin splints. Like, what are we doing? So I mean, I would argue that like we need to take a step back, and before cross country or track starts, maybe we need to be doing some like prehab and doing some foundational movement, looking at how do they squat, and then also educating the athletes on how do you care for your body when you are an athlete. Like, so when you're, you know, are you doing a proper warm up? Are you cooling down afterwards? If you are having pain in your shins, are you icing your shins after activity so you can prevent them from getting worse? So I think it takes some education, and I think especially at the, and I think it was said in Jason's talk too, like it depends, you know, where they're at. If they're coming in and they're, even if they're 15, but this is the first time they've ever run, they're, you know, we're going to train them like an 8-year-old versus if they've, you know, they're 15 and they've run since they were 4. So those kids who haven't done activities, you kind of almost have to take them aside and give them some information on how to take care of themselves, hydrate, sleep, all those things that we talked about. And then just coming up with, I mean, I think for running, there's so many resources. You can go online and just find some good like pre and post workout, here we go, exercises that they can do. Does that help? Yes.
So I am curious your thoughts on specializing on a versatile sport. I have a...
Because you're a biathlete.
Because I'm a more cross-country
Oh, cross-country,
skier now,
okay.
but I have a younger sister who's joined the youth team, usually a 10 to 12-year-old team, when she was 7 because she was so good at it and just wants to focus on it. She's almost 9, but she still just loves the sport and doesn't want to do anything else. Cross-country skiing, it's pretty versatile, full body, but my parents are a little worried that she's specializing early.
Yeah, so the question is, like, for that young athlete who wants to specialize early, and what advice do we give? I think kind of what I said, I'm not here to say you can't do your sport, and, you know, I think we're not going to stop people from early specialization. Like, that cat's out of the bag. Like, it's too late to do that. But what we can do is we can educate. And so if your sister's happy and doing well and like not having any problems, great. But let's make sure she's getting good sleep at night so she can recover. Let's make sure she's hydrating and having good nutrition. And let's make sure she's functionally moving well. And you know, for cross-country skiing, it's an intricate movement. So does she have the control? And then also, let's recognize when she goes through growth spurts that maybe we need to back off on her training a little bit and augment it with other stuff that uses her body differently. Yes?
So like in a lot of like high impact sports, so like running, dancing, you throw them in the pool to cross train, right?
Right.
So they can offload the forces that they're experiencing on their own healthy. Do you think we should do that the opposite way? So take aquatic athletes and get them out of the pool to get them having things like that.
Yes. Ding, ding, ding. So the question is, we do a really good job of taking our ground reaction force athletes and putting them in a pool to kind of offload them, but what are we doing for our aquatic athletes, and should we be doing the reverse? And I think that's an excellent point. I think our swimmers, we know they're not getting the bone density. Like I told you, you build bone until you're 30, and if you've been in a pool the whole time, you're basically a mermaid and you don't have the bones that you need. So we need to be putting them on land, and swimmers they're tough. I've had swimmers tell me, I need to be in the water, I'm gonna lose the feel of the water if I'm not in the water, but we need to make them comfortable on land and let them do the strength training and do the things that are gonna make them better swimmers and make them not burn out too. Yes.
I know we're short on time, but what are your biggest tips for balancing the principle of progressive overload and proper principles of recovery?
And I have 10 seconds. No. Okay, wait. Okay, what are my thoughts on progressive overload and principles of recovery?
Yeah, balancing.
Balancing. I think in relationship to a youth athlete, I'm assuming. So I think you definitely have to load the system, right? So we talked about, like, I think if we set the heater to 72, we never change it from there, you're never going to get better. But we have to recognize where that youth athlete is in their development, right? So it's fine to overload someone if they have great movement and they can do all the things we want them to do. But if we're trying to overload someone who has horrible mechanics, we're setting ourselves up for injury. So I think, again, taking that step back and making sure, first and foremost, that the foundational movements are intact, and then allowing for that progression. We know that overtraining is kind of the the last step, but that step before that, the overloading, is what we need to do to get better at sports. So we do need to overload our athletes in a safe way with education. So our coaches who are doing it need to have a plan. It can't just be what they were doing 20 years ago when they were in that sport. So I think we need to take science and understand where our athlete is. And it's difficult if you're taking care of a whole team, because 3/4 of the team might be ready and 1/4 might not be ready. And so how do you separate out the kids? If you're training an individual, it's much easier. But I think it gets really difficult for our youth coaches to kind of balance those principles in a large group setting. And then recovery, 100%. We need days off. We need time to let our bodies repair. And so that's the other question I always ask my athletes is, what day are you not training? And what are you doing on those days? Like, you can take your dog for a walk. And I mean, I'm not suggesting that you just need to sit on the couch and play video games, but I think you need to be giving your body a chance to kind of catch up with the stuff that you're doing.